Today I want to talk about something very important, and that is testing your urine. We can't just run to our primary care every time we think something is wrong, and you can just do a little simple test and find out what's going on. So I want to discuss these 7 things. I mean, there's more, but as far as bodybuilding and gaining muscle, I want to focus on these 7 things. Let's discuss it. Building your body is not an easy process, as some of you guys know by now. It takes years and years of dedication and sacrifice to actually reach the goal you want. One of the things you could actually test your body to make sure that you're going in the right path. It's as simple as just testing your urine at least once a month. It tests for a lot of things, but as I said, these are the 7 things that are actually concerning when it comes to building muscle. So let's discuss these real quick. One thing I would say first, do not take this test. Don't leave the gym and then an hour later try to do this test. You will never get an accurate reading. Protein. If you have protein in your urine, let's talk about the serious thing first. Kidney stone, kidney disease. That's what it's going to show up as. So if protein is in your urine, these are the number of things that it actually could cause. Dehydration is also going to show up. So intense training, if you break down your tissue too much and raise your CPK level to up over, I say 200,000, then yeah, you're going to see protein inside your urine. Leukocytes, this is a fancy word for saying your white blood cell count. It checks for UTIs and inflammation. Glucose, that checks for if you're a diabetic. If you're 180 deciliters, over 180 deciliters, that means that you're a diabetic. So there's a lot of tests. I'm going to actually show you guys another blood work that I actually do at home, but let's stay focused. Nitrates. Now nitrates is for bacteria, but it's the same thing as, say if you have too much bacteria in your body or the wrong type of bacteria. The nitrates actually is a test that they do for gonorrhea and E. coli. So nitrates will show up on your test strip if that's what's going on with your body. Blood UTI. Now, intense training. If you overtrain, your blood UTI will be high. So that's why I recommend do not take this test a couple hours after you leave the gym, because you're going to get a negative result on your whole entire panel. So do not do this. But blood UTI, it will show up if you actually overtrain. It will show up in your urine. Urobilinogen. This is for liver damage. Like I spoke on another video about fatty liver, but this will actually test for liver damage. It also tests for hepatitis. So urobilinogen tests for hepatitis, and the nitrate tests for gonorrhea. But I know that's not a concern in the whole bodybuilding community, but I just had to say it and put it out there. It's an easy test you could actually do at home. And the last one I want to discuss is your pH balance. Making sure you have enough alkaline in your water, what you're drinking. Make sure that your alkaline level is above 6, between 6 and 10 is a good range. Anything over that, it will start showing up in your urine. Anything below that, the acid will start showing up in your urine. So you want to make sure that you actually test. I have a water test that I'm actually going to do probably later down the line to show y'all how to actually test your water. But yeah, you want to make sure that you're actually testing it to make sure that you have the right pH balance in your water. All right, so now the product that I recommend. This is actually a ketos test. It basically tests everything to make sure that everything is at a normal range. Just a test strips. You pee in a small container. You drop one of these in, you wait 15 minutes, and it will tell you everything that you need to know. 90% accuracy of what's going on. Also, it's if it's a glucose and you see you're diabetic and you see the glucose thing come up on your test strips. I also have this. because you need to make sure, this is not going to tell you. Now 180 deciliters is when you know you're diabetic. But what if it's only 110 or 120? Then you have to know exactly what the numbers are by just using a blood test strips at home to make sure that you're not a diabetic because of the overtraining that you're doing, or you're raising your insulin level too high when you overtrain. That could push you in a diabetic state. So let's stay healthy. Let's test for everything. It's not about just going in the gym, pushing. Let's check on the inside of our body to make sure that we stay healthy. See you guys on the next one.